Welcome back. Hope you're doing well. The theme of the video today is cancer and hair loss. Obviously a tough thing to talk about. Many patients out there, many people are facing tough choices with cancer. And with cancer, most of the time comes hair loss. Not always, but sometimes. And so an interesting study that was published a few years ago actually showed that in patients with cancer, deciding whether they're going to have chemotherapy, radiation or not for their treatment, one of the main concerns they had, obviously, other than their survival and the effectiveness of the treatment, was how much hair loss they're going to have. So it is a very common concern that we see here. I see patients all the time who either have been diagnosed with, say, breast cancer or ovarian cancer, and they're now facing decisions on their treatment, and chemotherapy has been indicated for them versus surgery, or even addition to surgery, whatever. And then the chemotherapy, they've been told that the chemotherapy can and possibly will cause severe hair loss. And they're coming to me to see whether they can prevent it or if the hair is going to come back afterwards. So I wanted to put this video together just to show you and share some information with you if you or someone you know is facing these decisions. First of all, obviously, hair is only hair. It's important for us, important for our appearance, for our self-esteem, but you have to be careful to take care of your health first, right? That obviously comes as a priority. So do what you need to do, go to the treatment that's recommended for you, and we hope obviously that everything goes well and that you are cured from the cancer. The hair, the best thing that we could do for hair is prevention. I normally recommend to my patients, if I get to see them before, that they look for options. I'm gonna put a little link here. I'm gonna put a couple of links for you in the video of companies that can help you through that. Some of the cancer centers across the country have what we call scalp cooling devices. These are machines that when you go have your chemotherapy infusion, they will cool your scalp temperature. They will lower the temperature. That will limit the amount of chemotherapy agent that can reach the scalp, and therefore will protect your hair. So there is a website that I'll share here that is very good, and you can look at their map and see the locations where they have these devices. So you can look, maybe you can get there and have it done in a place like that, so you can have the cooling system done. You can also order some cooling scalp or cooling helmets from the internet. Those usually you leave in your freezer and it gets cool, but those are really, they don't last very long, so they're not really that effective. That machine, the scalp cooling machine, is called the DigniCap, as you'll see on the link here. That is really the way to go, because it'll keep your scalp at a very low temperature and it cools it down slowly. Then the cooling goes away slowly too, so you don't feel discomfort. Okay? The other thing too is there are companies that can hook you up with wigs or hair pieces or prosthesis of hair that you can wear during the time that you lost your hair. And so I'm also going to link a very good service here for you to take a look at. There's other resources too. You can go to the American Academy of Dermatology. You can go to the American Hair Loss Council. Those are websites that can give you some resources too. If you have lost your hair from chemotherapy and didn't get a chance to prevent it to some degree, that's okay too. So hopefully now the cancer is all gone and you're better and you recovered. So now you're doing the next step, which is, okay, what about my hair? A lot of times hair will grow back after you have chemotherapy. Chemotherapy agents, what they do, of course, they are designed to kill cells that are multiplying fast, which is cancer cells, right? Now hair cells also are like that, they multiply fast. That's why chemotherapy, some chemotherapy agents, I should underline that, not all of them. Some chemotherapy agents can cause hair loss. A lot of times the hair will grow back. Some people recover all their hair. Some people recover most of their hair. Most people recover, I think, most of their hair. If you had an underlying hair loss issue that was just not showing up, or it was pretty moderate, that the hair that comes back may be thinner than it was before. It may be different texture, maybe a little bit wavier, a little bit curlier, but hair is hair, right? So you can always deal with that. If you finish your treatment and you want to accelerate the hair growth, talk to us or talk to someone in your area that specializes in this, that knows what to do, because there are some things you can do to maximize or to speed up your growth. I'm not going to mention any names here because everybody's different. I don't want to make recommendations based on not knowing the patient that I'm treating. So, but there are options to expedite your growth. But rest assured that for the most part, if you lost your hair due to cancer, most of it will come back. So I hope this was helpful, give you some hope. Wish you the best, obviously, to you, to your family member, to your friend. Hope everything goes well there. And if I can be of any help, just let me know. Give us a call, the number here below, and we'll take care of helping you out. Okay? Look forward to seeing you later. Take care.